Hi, I'm Dr. Stefanie Christian. Welcome back to Tuesdays with Timeless. So today's topic is cheek injections. And you might ask, why would we inject the cheeks? Well, for two reasons. The cheeks are considered the mid-face, and they do two very important things. They are the underframing for the eyes, and they are the tethering for the skin, which impacts the appearance of the lower face. So first, let's address the eyes. In Western cultures, the eyes are the focus of the face. It's where we show our intellect, our humor, our self-confidence, our interest and attention to the person with whom we're speaking. The eyes are naturally framed. They're framed by the brow bones, and if we shape our eyebrows, we shape our eyebrows along our brow bones. Underneath, they're framed by the zygomatic arch, which is the cheekbone, and just beneath, they're framed by the apples of the cheeks, which are fat pads. As we age, we lose volume. We lose volume in the fat, in the muscle, and in the bone. And as this happens, we first see it here, and that usually happens around mid-40s. And as that progresses, we tend to see a hollowing here in the apple of the cheek. We also see some hollowing in the tear trough, and that makes us look tired. But as this hollowing happens, that extends that down, and we look tired. And no amount of sleep makes that go away. As this loses volume right back here, and part of that is fat, and part of that is muscle, and part of that is bone, we lose the tethering, so the skin drops. And when that happens, the corner of the mouth drops a little bit, and we start to have a little bit of jowling. So an easy fix for that is to replace the lost volume. It fills in the hollows, so you don't look as tired, and it gives tethering to the skin to lift things up. So what do we inject? Well, there are a lot of different fillers that are used, and now different biostimulators that are injected into the cheeks. And it can be hard to be a consumer. So I thought I would take some time to talk about what they are and what their pros and cons are. And I would start with the easy ones, the ones that people have probably heard the most about. And those are Restylane Lift and Juvederm Voluma. You've heard about Restylane and Juvederm because they have a whole family of other fillers, but their particular fillers that go into the cheeks are Restylane Lift and Juvederm Voluma. These are hyaluronic acid, which are naturally occurring substance in the skin. It's made synthetically into these fillers, but these are just fillers. They don't have any kind of collagen building effects. They're not biostimulators, and they get injected, they get metabolized, and then they have to be re-injected. The pros, they have an effect right away. You see them as you walk out the door. They can be reversed. You use hyaluronidase, which is an enzyme, and it reverses the hyaluronic acid, which is the major compound in these fillers. Cons, pretty expensive. In our area of Ohio, about $700 a syringe for Restylane Lift, and about $800 a syringe, and a syringe is 1.0 cc's. So $700 a cc for Restylane Lift, $800 a cc for Juvederm Voluma. And you need to be injected multiple times. You just have to keep being re-injected, and you will probably need to be injected with increasing amounts over time because you will continue to lose volume. The next is Belafil, which is cow collagen or bovine collagen. It used to be called Artifil. It's mixed with little tiny microspheres of a synthetic, and it's considered semi-permanent because it can last up to 10 years. The pros, it's only injected once every 10 years. It costs $1,000 a syringe, which is 1 cc. But if you think about it, most people think you need about 3 to 5 syringes. If you space that out over 10 years, that's still not very expensive. So, cons. You need testing to make sure you're not allergic to bovine collagen, and you need to do that 30 days before the injection. But probably the biggest one is that it's not reversible, and you're injecting it deep in the cheeks. The only way it can be removed is surgically. That's awfully invasive on the cheeks. Next, I'm going to talk about Sculptra. Sculptra is a biostimulator, which means that it stimulates collagen formation, but it is not a filler. Sculptra is made of very finely ground absorbable suture that is then dissolved and resuspended in normal saline. Now remember, before we were talking about tiny, tiny volumes, 1 cc, when we were talking about Voluma or Lift or Bellafill. With Sculptra, we're talking about 7 cc's. So we're talking about an entire different level of volume being injected into the cheeks. But there is no filler here. This volume that's being injected into the cheeks is normal saline. So it's injected, it gives a lovely volume, but 2 days later it's gone. The work is done by those teeny tiny little particles of absorbable suture, which set up a strong inflammatory reaction, which stimulates fibroblasts to make new collagen. And it's that collagen that over time builds real volume. But it's a slow cellular process. These happen in injections that are spaced 4 to 6 weeks apart. And the company used to recommend doing 2 vials at the first, 2 vials at the second, and 1 vial at the third. I've gotten to be friends with a number of injectors at the national meetings that I go to who used to inject that way, but who now say that after years of injecting, they feel like for most people, they can accomplish a great result with 3 vials. 1 at the first injection, 1 at the second injection 4 to 6 weeks later, and 1 at the third injection 4 to 6 weeks after the second injection. It's really important for patients to understand they may not see an effect until between the second and third injection, and they won't see the final effect until between 3 to 6 months. And when between 3 to 6 months has everything to do with how they eat, what the overall inflammatory reaction is in their entire body, and all those things we discuss in our practice. So the pros of Sculptra: it can last up to 2 years. That's it. Cons: you really have to manage patients' expectations because they see a lovely fill after each injection and the fill deflates in 2 days. Con number 2, it's expensive. National average is $1,000 per vial. It's not great for someone who has adult acne. It's not great for someone who has rosacea, both inflammatory conditions. And my other big concern is that it's not reversible. If you don't like the way it looks, there's nothing that can be done about that. So there is a biostimulator out there that is not based on inflammation causing the collagen formation, has a filler effect, and is reasonably priced. My favorite injection in the cheeks is Radius. Radius is 2 things. It's a filler, a very viscous filler, and we'll talk about what that is, and a biostimulator. It's little microparticles of calcium hydroxyapatite, which are like teeth or bone, tiny microparticles. And after injection, they come together and they make a scaffolding And then without any inflammation, the body builds collagen on that scaffolding. It's the scaffolding itself that stimulates fibroblasts to make collagen, not any kind of inflammation. In addition to that collagen building, it has this super viscous filler. So what's viscosity? Well, we have so many different fillers and we use them for all sorts of different things. Like in the tear troughs, if someone has very shallow tear troughs, I want to put something in there that's almost watery because I don't want it to make a lump. So that's low viscosity. But if I want something in the cheeks that's going to tether the skin, I want it to have a lot of viscosity. So if I have a surface and I squeeze out some voluma and I squeeze out some Restylane Lift and I squeeze out some Radius, and then I tilt that on its side, the voluma will start to run and the Restylane Lift will start to run and the Radius will sit there like a nipple. It has viscosity, internal viscosity that holds it together. So it's not runny and slippery. And that means it's going to stay and hold and actually give lift, not just volume. And that's one of the important things we're trying to do, remember, about the cheeks. So that's the biggest thing that I love about Radius. 2, it's not nearly as expensive as the rest of these. It's $700 for a 1.5 cc syringe. So you're getting 50% more volume for the same price as Restylane Lift and for $100 less than Juvederm Voluma and significantly less than Sculptra. The competitors all say, well, but Radius can't be reversed. Oh, yes, it can. It can be reversed with sodium thiosulfate. So that argument's not realistic. So I really like Radius. It's almost impossible for someone to be allergic to the same compound they have in their teeth and their bones. Now, every once in a while, I will have someone who Radius doesn't work in, and then I'll use Voluma. I simply like the effect of Voluma better than I like the effect of Lift. But they're spending a lot compared to Radius. So Voluma is never my first choice. It's my second choice. So we've gone through the why and we've gone through the what. Now the how. Ideally, if I have enough time, I like a patient to stop aspirin, ibuprofen, naproxen, fish oil, vitamin E, and then there are a couple more if someone is truly a bruiser. But those are the ones that I want everyone to stop a week before they get a filler. And then I like them to stop alcohol 3 days before. Then they come in and I have them holding ice on their cheeks while we talk before the injection. Ice decreases the size of any blood vessels that are there. I inject using loops, so I can see very, very small blood vessels, but there are still microscopic vessels that I can't see. So if we can shrink those, the ones that I can't see, there's even less of a chance that I'm going to hit them. And then we prep the skin and clean it all off, and then I mark where I'm going to inject. And I mark based on where the hollows are and where I can get the best lift. And then I inject. And I inject under the muscle and over the bone. It's considered a very safe area. It's considered an avascular area, which means there aren't vessels there. It's sort of some filmy connective tissue there. It's not a very painful injection. There are some injections that we do that don't feel very good, especially like around the mouth. This is not a particularly painful area because there are not a lot of sensory nerves on the cheek. What everyone comments on is that there's a funny sound. It's sort of a snap, crackle, pop sound. And as long as you're prepared for that, because I've told you about it, then it's not something that's going to get to you. And then we're done. And how about the results? You have immediate lift and fill. You walk out the door looking refreshed and rested, and you don't look tired anymore. I don't do injections to make people look like Hollywood starlets that have been overdone or crazy housewives from wherever. And so I really don't like an over-injected look. And so it means that I have people come back a little more frequently in order not to get an over-injected look. I do recommend that people not sleep on their sides for 3 nights. Even if you're a side sleeper, we have all sorts of very easy suggestions to keep you from doing that. This stuff is malleable for the first 72 hours, and you don't want to have to come back in and have me re-inject you because you slept on one side and flattened it out. But that's really sort of the case with almost all of them, except Sculptra. So, it's the end of the discussion for cheek injections. I hope it answered any questions that you have. If you have other questions, please comment below. I love the interchange with that. And I'll see you again next week.